Greetings. I'm Dr. Steve Tashiro. I've worked in the healthcare field for over 37 years, and during that time I've had the pleasure and privilege of helping thousands of people overcome chronic health conditions, and very often doing so involved needing to regulate sugar regulation. Today we're going to focus on type 2 diabetes, but understand that it's just the final stage in a progression in which healthy sugar regulation is lost. Current U.S. health statistics are quite alarming. 1 in 4 Americans, or 70 million, have diabetes or prediabetes. This is an epidemic of epic proportions, and it's expected to get worse. In 2008, for example, U.S. healthcare expenditures totaled $2.3 trillion, which was 8 times the $253 billion which was spent in 1980. Diabetes is a big part of this. In fact, health actuaries estimate that diabetes will be the single condition that could bankrupt our healthcare system. And it's understandable why, because there are serious complications with uncontrolled diabetes. It's the #1 cause of acquired blindness and kidney failure in our country. The #7 overall cause of death. 60 to 70% of diabetics will develop peripheral neuropathy, which is damage to the nerves in the feet, legs, arms, and hands. 60 to 70% develop sexual dysfunction. And with diabetes, you have an increased risk of heart attack, stroke, amputations, and Alzheimer's. Now, these conditions all occur because when sugar levels rise, it coats the red blood cells and therefore interferes with circulation. And this can cause an increase of cholesterol levels in the blood vessels. So that's one reason why diabetes is so hard on the eyes and the kidneys. So who's at risk for developing diabetes? The primary risk factor is being overweight, because when there's increased body fat, there's an increased resistance in your cells to insulin and glucose. And we'll talk about how that all works. Especially if the fat is concentrated in the belly, that's especially a high risk. Inactivity is another risk factor, because when muscles are being used, they take sugar out of the blood for fuel. If you have a family history of diabetes, you're at increased risk. People that are over 45 years of age tend to be at higher risk because their activity levels tend to decrease. Although these days, it's more commonly found in children, adolescents, and young adults than 20 years ago. Certain ethnic groups are at higher risk. This would include African American, Latino, Native American, Asian American, and Pacific Islanders. But like all chronic conditions, diabetes doesn't just develop overnight. You go to bed one night, you don't have it, you wake up the next morning and you do. As I said, it's a progression. It's the result of a long process of decreasing function in the organs that regulate sugar balance. So let's look at this chart and we'll review the basics of sugar regulation. We'll talk about normal sugar regulation. The key players in that process begin with glucose, which we obtain from the food. Glucose, of course, is sugar. Glucose gets into the bloodstream, and that acts as the trigger to tell the pancreas to release insulin. Now, insulin's job is to carry the glucose into the cells, and inside the cell, the glucose, along with oxygen, are combined to produce metabolic energy or fuel. Other players in this process include cortisol, which is a hormone produced by your adrenal glands. Cortisol causes a release of sugar stored in liver and muscle between meals, so that even if we're not eating, we have normal levels of blood sugar. Glucagon is a hormone produced in the pancreas, and its job is to release sugar from the liver, again at times when we're fasting and sugar level is dropping. Thyroid hormone is very important because that improves the transport of sugar into the cell and also improves the uptake of glucose from the GI system. So this is how it's supposed to work in a process of health. But there's many ways in which this can break down and not function properly. The single biggest cause in some ways would be the standard American diet. It's called the SAD diet, and really it is very sad because it has huge health implications. For example, if you have the typical SAD breakfast, coffee, juice, cereal, that's high carbohydrate. If you put sugar in your coffee, it's even higher. So now that concentration of sugar hits the bloodstream, the blood level of glucose spikes, and it causes the pancreas to release a large quantity of insulin, because that's its job. The insulin then carries the sugar into the cell, which it's supposed to do, but because there's been a large quantity of insulin produced, now the sugar level drops too low. This is when symptoms of low blood sugar occur. That would include being shaky, getting headaches, being hungry, irritable, increased heart rate, especially between meals, with relief and increased energy from eating. Now, over many years, if you've been consuming the SAD diet and this process is repeated, the pancreas starts fatiguing. But because it's been called upon so many times to produce large quantities of insulin, your cells begin to resist the presence of insulin. Because you've had repeated spikes in insulin from repeated spikes in sugar, now your cells are so used to high levels of insulin they don't allow the insulin to carry sugar into the cell. It's kind of like if you live in a house that has strong odors, over a period of time you lose awareness of the odors, but someone walking into your house for the first time would notice them. That's kind of how insulin resistance begins and perpetuates. Symptoms of insulin resistance are often the same as low blood sugar. The key difference is that if you eat a meal that has carbohydrate, especially too much, you'll crash, fall asleep, get tired, lethargic, have brain fog. Whereas with low blood sugar, after that meal, you'll tend to have an increase of energy. The reason you get fatigued if you've got insulin resistance and you eat a carbohydrate meal is because now that your body is less able to get the sugar into the cell, it's being converted instead into fats, triglyceride, cholesterol, low-density cholesterol. And that conversion process is very energy intensive, and that's what makes you tired. If you've got a lot of belly fat and your stomach has a wider girth than your hips, that's another key criteria for insulin resistance. With insulin resistance, once the sugar level drops, you get a spike of cortisol, and that mobilizes sugar from the liver. And that can create problems too, because it can wear out the adrenal glands and sets the stage for a lot of other problems. So with diabetes, so we've talked about low blood sugar leading to insulin resistance, and now diabetes, which is you might say the end stage of that progression of breakdown. With diabetes, there's usually insulin resistance, so insulin is not being allowed into the cell. But after time, the pancreas poops out and is just unable to produce insulin because it's been called upon so many times to produce a large quantity because of spikes in blood sugar. Now, there may even be an autoimmune aspect to diabetes. This is where immune antibodies, are attacking a certain part of your pancreas where the insulin is produced. So symptoms of outright diabetes would include increased thirst and urination, because when there's high sugar, fluid is drawn from your tissues and it goes into the urine. Increased hunger because sugar is not getting into the cell. Fatigue, blurry vision, wound healing, and ulcers on the skin. Frequent infections, especially yeast infections, and if you have neuropathy resulting from the diabetes, numbness, tingling, pain in the hands and feet. In order to diagnose diabetes with lab testing, we would look for a random plasma glucose of over 200 or fasting blood glucose over 126. A blood glucose over 200 2 hours after consuming 75 grams of glucose. If that occurs 2 times, that would be diagnostic of diabetes. But the best test is hemoglobin A1C. Hemoglobin is in your red blood cells, and when there's high sugar, the hemoglobin tends to take up sugar at a higher level. And a hemoglobin A1C over 6.5 would be considered a sign of diabetes. With prediabetes, which is the stage before diabetes, fasting blood sugar of 110 to 125 is what we look for. Ideally, your fasting blood sugar would be between 85 and 100. It's natural for your sugar level to rise after a meal, with a peak occurring about 1 hour after the start of the meal. But by 2 hours after beginning the meal, the sugar level should return to between 85 and 100. Let's talk about the medical treatment for diabetes. Initially, it would be oral drugs, for example, glucophage or metformin, which causes a decreased glucose production in the liver. Glucophage typically is given if your fasting blood sugar level is between 127 and 200. Like all medications, there are side effects. It can cause lactic acidosis, and in about 9% of people who use glucophage, it can cause a B12 deficiency. If stronger control is needed, for example, if your sugar levels consistently run well over 200, that's when insulin could be introduced. Please understand that while insulin may be necessary at times, it carries significant health risks, because understand that with diabetes, your cells are already resisting insulin. So why give more if your cells already resist it? It can make your insulin resistance worse. Go to www.mercola.com, M-E-R-C-O-L-A. This is Dr. Joseph Mercola, and it's the world's #1 alternative healthcare website. And look for the article entitled, "Is Insulin Condemning You to a Premature Death?" So insulin can be one of the worst things you can do in terms of long-term health prospects. It is very hard on the body. It causes an increase of inflammation, joint and muscle pain, weight gain. It can cause an increase of blood pressure, clotting, stroke, heart attack. It can increase your risk for breast and prostate cancer, and likely your dose will need to be increased over time. And also, drugs used to treat conditions associated with diabetes, like high blood pressure, cause an increase in blood sugar. So that would be the beta blockers and some diuretics. So if at all possible, it is so much better and makes so much more sense to manage your problem using alternative non-drug approaches. I want to be very clear in stating that I don't treat diabetes. I don't treat any condition, really. What I do is evaluate your body chemistry, make recommendations to restore optimal physiology, and the rest takes care of itself. In this regard, alternative non-drug approaches are very effective for regulating sugar levels, especially if we begin these in the early stages of sugar regulation problems. These would include dietary management, primarily eliminating sugary foods and grains. Exercise is essential, starting with about 20 minutes a day, because that causes the muscles to burn the sugar from the blood. We need to optimize vitamin D levels as well. And we need to optimize the function of key organs involved in sugar metabolism. This would include the pancreas, adrenals, thyroid, liver, and the entire GI system. We evaluate these organs using lab tests and questionnaires. And again, we support their optimal function using nutritional, herbal, and homeopathic supplements. If you've had a chronic problem with sugar regulation, it's also essential to evaluate and support your nervous system. I'm talking about your brain and peripheral nerves. Because when you have fluctuations in blood sugar, it damages nerves as well as your brain. And that's why Alzheimer's is referred to as diabetes of the brain. Brain-based therapy is a term that refers to the methods we use to evaluate brain function for a decreased frequency of firing. We refer to that as a soft lesion as opposed to a hard lesion, meaning it's a decreased electrical vitality as opposed to a tumor or a stroke. When you have fluctuations in blood sugar, low levels deprive your brain of fuel, high levels create osmotic pressure that damages the brain mechanically. So when this has been going on for a long period of time, your brain starts to suffer. We have to find out which part of your brain, which lobe, and which side has been damaged. Usually it's the frontal lobe or the parietal lobe. What are the symptoms of brain damage or a fatigued brain? It would include brain fog, decreased sensation in your body, decreased perception of stimuli, mood changes, short-term memory loss, changes in handwriting, poor concentration, balance, loss of mental focus. Once the deficient areas are identified, we target those areas with brain neural rehab to wake it up, to jumpstart it. It's like jumpstarting a battery that's worn down. With sugar regulation issues, peripheral nerves are often damaged and need to be evaluated. If you have peripheral neuropathy, you might have numbness of your feet or legs, loss of sensation, tingling, poor balance, or even pain, as in sharp, stabbing, electric pain. We refer to that, by the way, as hyperalgesia. It's a sign that nerves are overfiring. We need to reduce inflammation and improve nerve health with different modalities. This would include a device called the Rebuilder, which actually rebuilds and repairs the nerves. We can use infrared light therapy, microcurrent, and these are all very effective for restoring optimal nerve function. So in summary, in spite of the terrible consequences of diabetes, it is actually one of the most avoidable of all chronic diseases. So I encourage you to take action. Here are some possible action steps. You can call our office and reserve seating at our next free diabetes seminar. These are 1 hour in our office. We go into the information in more detail, and there's time for questions and answers. Call our office at 303-985-5540 and tell Jennifer you'd like to attend our diabetes workshop. But if you've heard enough and know that you want our help with your sugar regulation, call and schedule a 2-visit case review and consultation. On visit 1, we do a complete neurological evaluation of your brain and peripheral nerves. Bring your lab tests. We have you fill out questionnaires that tell us about your internal organ function and how your condition has affected your quality of life. At visit 2, I let you know if I can help you, if you're a good candidate to be benefited from our program. And if you are, I tell you what further testing needs to be done. Then I tell you how often we need to see you and for how long. What are the expectations for improvement? And of course, we cover the cost, including insurance reimbursement. It's very important that your spouse or significant other be present for that visit. So thank you again for taking the time to review this information. I've enjoyed sharing it with you, and I look forward to seeing you at our seminar or in our office for the 2-visit case review and consultation.